This video is entitled Why Threadlifts Suck. Pretty controversial title, but I really do believe they absolutely do not work. And when I'm talking about they don't work, I don't mean that they're just slightly okay. They'd give it just a little bit of improvement. They do nothing. Goose egg, zero, zilch, nada, niente, rien, nothing. They don't do anything. There's zero for them. And so even if you said, well, let me just do something a little bit better, just give me a little bit of improvement, they just won't do anything. So why won't they do anything? What is my experience with them? So first of all, I used to do them. So I used to do them 10 years ago. And they went out of favor and they just fell off the market, and they came back a few years ago. So actually it was probably 15 years ago I did them. They came back on the market maybe 5 years ago, and with a lot of fanfare. And the reason why, and they say, well, it's new, it's different from there is nothing different. I was part of a conference where I heard from the company that brought it back into vogue that there was some adjustment to it, and I looked at the before and afters. There's nothing. There's a zero gains on these, and the reason why it's become so much more popular now is that there's basically been a resurgence with other companies jumping on the bandwagon from this initial company, thinking, okay, if this company is doing it, well, we should do it. They've offered more and more versions of it. The reason I thought of this video, I did a podcast on this last year, is that I met a patient this morning who had a facelift with decent results about 10 years ago, had a thread lift last year, so it was so painful, did nothing for me. I said, well, I better shoot another video talking about this. And so fundamentally, they're flawed issues. So in the past, I used to do even called SMAS lifts, which essentially is full facelift incisions, not much different from the way I do a deep plane facelift. But I would pull all those deep tissues up, and I would get not that great results to begin with. And this is a 4-hour surgery where I'm actually suspending those deep tissues rather than the skin. And I'm still not getting great results until I've done the deep plane, which if you can listen to those videos, I've released some ligaments to get that elevation. But with a thread lift, you're doing pretty much nothing. You're putting a thread in the subcutaneous plane, which is in the superficial tissues. It's really not suspending anything. And if I'm doing a 4.5-hour surgery and getting minimal results on it, you can imagine what a 30-minute thread lift does, which is even less than nothing. So they just don't do anything. Fundamentally, the problem, it's a fundamental understanding of a problem, which is the fact that the deeper structures need to be released and elevated in order to get a durable, reasonable result. And if you're not even manipulating the deeper tissues, even when I manipulated the deeper tissues without a ligament release with a standard facelift, I still didn't get great results with it. I can't imagine the thread lift doing anything, and I used to do them. And so this is the big thing with patients to understand this, is that I sort of divide aging into skin, gravity, and volume. And each thing requires its own therapy. A lot of people think, well, if I fill this whole cheek, I'm going to lift the jawline. That's false as well. I have to probably shoot another video on some of those concepts. But I'm a big fan of non-surgical things. I'm a big fan of surgical things. Certain things need to be done surgically, and certain things need to be done non-surgically. The problem, it comes into play when you are trying to do non-surgical things that need surgical, and when you're trying to do surgical things to treat non-surgical. So an example would be if you need a facelift, you need a facelift. Or if you've got skin wrinkles when you smile, you need a dynamic filler or mesobotox, you don't need a facelift to fix that. And so when you try to do the wrong therapy, it's a problem. Or I've heard a lot of people say, well, I'm going to do a facelift to fix my acne scars. It's not going to work. It's barely going to do anything, if anything at all, because the problem is in your skin. It is not into trying to lift the tissues away. So this is showing, doing surgery to fix non-surgery doesn't work, and doing non-surgery to fix vice versa is a problem. So people say, well, I can't afford surgery. I don't want surgery. And that's fine, but don't waste your money. Don't even bother with a thread lift. Give that money to charity. Throw it, burn it, ignite it in a trash can. I don't care what you do, but don't even bother with the thread lift. It's completely useless. And so it's not even negligibly improved. Just don't even bother. So I understand if you don't want surgery, I'm not going to force you to do surgery. Everything I do is elective. The one thing you don't want to do is just waste your money and do something that's completely irrelevant.